Hey everybody, welcome back to another episode.
This is trying to go live.
Hey everybody, welcome back to another episode of Facebook Live. I'm your resident marketing intern, Kyle. Today we are here on the Sickles Sidelines, joined by our sports medicine specialist, Dr. Adam Morse. Dr. Morse, thank you for coming. How are you doing?
Doing excellent. Looking forward to a big matchup tonight between my Sickles High School and the Whartons High School team tonight.
Absolutely. So, Dr. Morse, in previous episodes we've talked about lower body injuries, we've touched on knee injuries, but for the folks at home, we kind of wanted to refresh them on one of the more common areas of injury, the ACL. So what does the ACL stand for, and what is its primary function in the knee?
So the ACL stands for the anterior cruciate ligament. Cruciate meaning cross. There's two ligaments right in the middle of the knee, and they actually cross over and help to stabilize the knee. The main function of the anterior cruciate ligament is rotational stability, so that when your knee plants and twists, the knee moves as a unit and it doesn't come apart and then come back together, giving you a sense of great instability.
Okay, and with it being one of the more common injuries, what is the mechanism of injury? In other words, how are our student athletes injuring this ligament of the knee?
So the most common is a deceleration injury or a plant and cutting injury. It's not a contact injury. While some ACL injuries are contact related from a tackle where they get hit and the knee buckles inward, more commonly is a sudden plant and cut or a sudden deceleration where you stop and the shin shifts forward so far that it tears the anterior cruciate ligament.
So are there any kind of treatment options, treatment plans that you would recommend if a student athlete came into your clinic and had a ACL injury? What would you advise them to do treatment-wise?
So typically they can have a partial tear which can be treated without surgery, but frequently in a cutting athlete that wants to return to that level and that type of activity, it's necessary to reconstruct or put a new ligament in its place. And you can do that from a variety of sources. You can use a hamstring tendon, a patellar tendon, or you can use a donor tendon from a cadaver, from somebody else's tissue that you can incorporate in your body.
Okay. And are there any types of preventative measures, any types of stretches or exercises that our athletes can do to possibly prevent and avoid injuring their ACL?
Balance training is very important for stabilizing the knee and being able to feel your position and be able to cut, as well as strength training, balancing your hamstring strength with your quadricep strength and not overcompensating with a weak hamstring with an overaccentuated quadricep strength.
All right, and if one of our athletes injures their ACL, what are the chances that they can come back to their peak performance? When they injured their ACL, what are the chances that they can come back 100%?
A large percentage of athletes will be able to come back to their pre-injury level. It's not everybody, but it's certainly in the 60% range will get back to their pre-injury level, and 80 to 90% will get back to some sports level as well.
All right, so it sounds like a pretty hefty percentage will come back.
Yes, that is correct.
All right, Dr. Morse, thank you for being here today. Guys at home, thank you for watching. You remember to like us and subscribe on YouTube, on Facebook, all of our social media channels. Stay up to date. We'll keep you up to date. Thank you for joining us here, Florida Orthopaedic Institute, where we will stay keeping you active. Thank you.